includes container and refrigeration requirements. So they govern that. There wasn't, since the city is out of that governing part of it, we leave that up to the state. So we don't want to confuse
Outside
things.
storage of it, would it not be something that you would read to
Waste.
make sure it's in compliance with that code?
So the state is the one that monitors that. There's requirements in the state code for under TSEC that it have to be contained in refrigeration. There's a certain degree of less than 45 degrees that it has to be stored in for medical waste.
And let me try it this way then. Is there something that says, okay, you're saying an outside body governs that, okay, but is it not somewhere within the city zoning that says, okay, look, we're not gonna place that type of waste within so many feet of a subdivision?
No, because that's not a use.
Storage related to the use
So the use is the clinic,
and any
the
byproducts
waste
that come out
or
of it?
trash services, that's not a use. So no, zoning would not govern that. That's again regulated by the state.
So its position in relationship to the proximity of the neighborhood is not something that,
That's not something that the city handles. The state is the one that handles the disposal and the containment of medical waste.
Any other questions for city staff and the commissioners? Okay, at this time, we're going to entertain a vote.
Chairman Shaw, I recommend that we not approve this amendment. I don't agree with the changing of the definition because the original definition was established by the state agency that licenses ASCs, and this change would not be as appropriate as the original definition.
We have a motion. Need a second?
second,
Motion and a second. Any discussion?
I don't completely understand that. I feel like we're throwing some confusing language in here. I don't think we've changed any definition. We've clarified, because it wasn't clear before, where ambulatory surgical centers go in our code. And we've used the state definition for ambulatory surgical center. So I don't see how, I'm not really sure what we're talking about here about changing a definition and having to be confusing. I don't think we're adding a state definition, so if people can support that or not support it, but just don't want us to get off on the wrong track about saying we're putting the wrong or the right definition in here. We're using the state definition. I just want to clarify that, and I want to support this amendment.
There are two state definitions, and I worked for the government for 33 years. There's always confusion within government. So it's being changed from the state agency that licenses ASCs to an administrative definition, which would be looser and not as accurate and not as protecting of the neighborhoods. So I'm against approving this amendment.
Could I ask our legal people to address that? Or legal people, Susan, could I ask you to address that?
The commission can certainly approve, deny, make alternate recommendations. Okay. I'm not sure specifically which definition. There is a definition in the Texas Health and Safety Code as well. They're somewhat similar, but they are not exact duplicates. I'd be glad to recite that one if that would provide any clarity, but it is up to this commission to make a recommendation.
Thank you. Any more discussion regarding subdivision?
Yes, could you recite that definition? And just tell us again what you're reciting as opposed to what we're looking at.
Yes, this is from the Texas Health and Safety Code. Ambulatory surgical center means a facility that operates primarily to provide surgical services to patients who do not require overnight hospital care. Now, in the definition that has been added to clinics, dental, or medical, we don't recite the Texas Administrative Code, nor would we propose reciting the Texas Health and Safety Code. It is a reference to help clarify. I don't know if you have seen the definition in the Texas Administrative Code. I certainly can read that to you as well, if you'd like to hear that. Ambulatory Surgical Center, ASC, a facility that primarily provides surgical services to patients who do not require overnight hospitalization or extensive recovery, convalescent time, or observation. The planned total length of stay for an ASC patient shall not exceed 23 hours. Patient stays of greater than 23 hours shall be the result of an unanticipated medical condition and shall occur infrequently. The 23-hour period begins with the induction of anesthesia. I believe staff thought that there was just a little more information here for guidance, and that was the reason that they chose the reference to the Texas Administrative Code as opposed to the Health and Safety Code. Because the primary issue is that they're not meant to be for inpatient care. And I think that is really the bottom line.
Okay, I mean, I would agree with that based on what you just read, that they're both getting at the same land use, if you will. But the one that you chose is much more specific about what inpatient or outpatient means. But again, substantively, they are both saying the same thing.
But none of those are listed here for this amendment, so that's why I'm opposed to the amendment.
If I can clarify, the definition actually references the Texas Administrative Code, Chapter 135, which is the last definition that Susan read. So that way, if the state law updates, which they could every 2 years, the definition of an ambulatory surgical center, we would not be required to, again, update our Unified Development Code. We just reference what Chapter 135 states.
These changes for the UDC we'll be stuck with for 5 years. So, I rest my case.
Unless chapter 135 is altered.
So if 135 is altered,
Could be 2 years.
Yes, if Chapter 135 is altered, that's what we rely on. Chapter 135 is altered every 2 years. It's the most updated one that we would rely on. That's why we aren't defining it, and we're not stuck with our definition for 5 years. We are essentially stuck with Chapter 135's definition every 2 years.
So just for clarification, we are trying to be congruent to the Texas Code. Provide the proper land use as dictated by the code, only with slightly more specific language.
okay, we have a motion on the floor. Any more discussion regarding the motion for denial? Okay, roll call vote, please.
Mr. Chairman, would you read the motion, please? I just want to make sure.
Go ahead. Those for denial.
Okay.
And just correct me if I'm wrong, Commissioner Salzer, you seconded the motion, correct? Okay. So we have a motion and a second. Roll call vote, please.
Commissioner King,
I would say yes to deny.
Commissioner Salazar,
Yes.
Commissioner Briones,
No.
Commissioner Martinez,
Yes.
Commissioner Romero,
No.
Commissioner Hurd,
No.
Chairman Shaw,
No.
motion fails. So basically, it's just gonna move forward as no recommendation for zoning commission.
Unless we have a motion for reconsideration, which I don't think we're gonna get. But if there's anyone who wants to give a motion.
If there is a reconsideration and there is a new motion, outline that process, as it move forward, we could move forward with a recommendation.
We would need 6 to approve a motion.
So I guess we have no motion for reconsideration, so therefore move forward to council with no recommendations from this commission. Next case, please.
Do you have one more?
Is there anybody else signed in to speak?
No, nobody signed in to speak.
Since there's nobody else signed in to speak,